Hello everybody, I am Dr. Samir Ahire. I am a board certified cosmetic and plastic surgeon. I am the director of Evolve Cosmetic Clinic and we are located in Mumbai and Goa in India. And in today's video, I am going to discuss regarding the pre-op markings, intraoperative, post-operative results of one of my patients. For her, I have done liposuction of arms. So let's start with today's video. This patient is a 40-year-old female patient. She came to me. She had done good amount of exercises. She had done muscle toning exercises, but she was not able to get rid of the fat around her arms. So she came to me. I did suggest her to go ahead with the liposuction of her arms. And as you all know, it's a daycare procedure. It's a painless thing. You need somewhere around 4 to 5 days for the recovery, and you start seeing the results immediately, but you see your final result only after 3 weeks. So this is the pre-op marking for her, in which we have marked her inner arm area in which we will be doing liposuction. This is the marking from the posterior aspect of the back part of the arm in which we'll be doing liposuction. Here one important thing is we never do liposuction of your lateral part of your arm because you have a good shape in this area. All your nerves are present in this area. So try avoiding doing liposuction of lateral arm unless and until it is very compulsory or you have bulge or some contour deformity for which correction has to be done. Otherwise, liposuction is only done for inner arms and the posterior part of your arm. So intraoperatively, you can see we have done the markings. We have started the procedure for her, in which we have taken half a centimeter, 2 cuts. One is the inner aspect of her arm and one at the posterior lower end of her arm. So through this half a centimeter incision, we have done infiltration, in which we have put a tumescent for her, which includes lignocaine, which includes a bupivacaine, soda bicarb, adrenaline in an RL. We did plan a liposuction for her right arm. We have infiltrated somewhere around 600 to 700 cc. On her left arm, we have put somewhere around 800 cc. So total of 1500 cc we have infiltrated. After waiting for 10-15 minutes, we started doing liposuction. You can see the kind of fat what we are extracting. It's a very good fat, and you can see her results immediately. After doing liposuction, her arms have become thin. It has gone inside. So these are the visible results you get immediately after doing a liposuction. Her results are going to improve. Post-operatively, these are the intra-operative, just after the procedure is done. These are the photos, videos in which you will see the arm circumference has gone down. To make a note here, she had an arm circumference of somewhere around 36 centimeter to begin with, and after doing liposuction, we have come down to somewhere around 30 to 32 centimeter for her. So her circumference has gone down by at least 2 inches here, and she is going to be very happy with the results. So if you are looking to get something to be done for your arms, a liposuction, come to us. My team will get in touch with you. They'll help you in your process. Thank you so much.